So we are discussing the LAQs of upper limb and lower limb, and we have covered the joints of the lower limb, and now moving on to the nerves. In lower limb there are only three major nerves: sciatic, femoral and obturator. Femoral and obturator have a root value L2, L3 and L4, both of them. L2, L3 and L4. But the difference, dorsal क्या बोले dorsal? Dorsal क्या? Dorsal ventral what? हाँ? Divisions. Okay, divisions. Because it's only the ventral rami which form the plexus, dorsal rami don't form plexus. When the ventral rami form the plexus, then it divides into ventral divisions and dorsal divisions. Dorsal divisions supply the extensors. Here extensors are here, anteriorly. And ventral divisions supply the flexors. Flexors and adductors. So when we discuss the femoral now, it is L2, L3, L4, dorsal divisions. Dorsal divisions, and when we talk about the obturator now, it is ventral divisions. So both of them formed by the divisions of L2, L3, L4, one from ventral divisions, one from dorsal divisions. Now this muscle passes on the lateral, this nerve passes through the substance of psoas and then emerges along the lateral border. While this obturator nerve runs along the medial border of psoas major muscle. It's very medial. Okay? And this, after going down, suppose here is anterior superior iliac spine, here is the pubic tubercle. It enters pubic tubercle. This is inguinal ligament. ASIS. It enters the thigh, femoral triangle, and divides into anterior and posterior division, separated by lateral circumflex femoral artery. Anterior and posterior division. But before entering the femoral triangle, it supplies iliacus and it supplies pectineus. Iliacus and pectineus. Okay? And then anterior division and posterior division. Anterior division is mostly cutaneous, very cutaneous, and posterior division is muscular. Okay? Anterior division will give two cutaneous branches, the medial and intermediate cutaneous nerve of thigh. And it supplies only one muscle, and that is sartorius. Anterior division supplies sartorius. Barabar? While posterior division is mainly muscular, and it supplies rectus femoris. Now to rectus femoris also supplies the hip joint. It supplies vastus medialis, vastus intermedialis, vastus lateralis, and continues down as saphenous nerve. Which is the only cutaneous branch, saphenous nerve, the longest cutaneous branch in the body. It starts from here and ends by supplying the skin or the shin and medial border of the foot up to the ball of the toe. तो shin का जो skin है वो saphenous nerve supply करते हैं, and medial border of foot also. Itna. Okay. Now to vastus medialis also supplies the knee joint. Knee joint. Now moving on to the obturator nerve. Now my request is obturator nerve. You don't draw, I'll give you 5 minutes break to draw that. Understand. Then you can understand this also. काढ नको ना डायग्राम पहिली बेंच मधला मुलगा. मी तुला देणार आहे ब्रेक 5 मिनिट. काय नाव तुझं? अभिजित. This does not pass through the pelvis. This passes into the pelvis along the lateral boundary of ovarian fossa, and then it comes out of the obturator foramen, and there only it divides into anterior and posterior branch. Anterior branch is anterior to adductor brevis. Posterior branch is posterior to adductor brevis. Posterior branch pierces obturator externus and it supplies adductor magnus. Anterior branch supplies adductor longus. So posterior branch supplies obturator externus and adductor magnus. Anterior branch supplies adductor longus. It supplies pectineus. It also supplies sartorius. Gracilis. It also supplies gracilis. Adductor brevis may be either supplied by anterior or supplied by posterior. Anterior division also supplies the hip joint, and posterior division goes down and participates in the subsartorial plexus, from where it also supplies the knee joint. So you can draw this diagram and try to understand, and I come back. The next is the sciatic nerve. Sciatic nerve it's the thickest nerve in the body, also called as pregnant nerve, because there is a presence of a
artery inside the nerve,
which is branch of inferior gluteal artery. This is branch of inferior gluteal artery. ये सब PG नीट में पूछते हैं. The artery accompanying the sciatic nerve is a branch of inferior. Sciatic nerve is a combination of tibial and common peroneal. So the lukewarm students say, they will say sciatic nerve का root value क्या है? L for alpha, S1, S2, S3. Sciatic nerve has two nerves, tibial and common peroneal. Both have separate root values, different root values. Tibial has a root value of L4 to S3 and common peroneal has L4 to S2. That is not the only difference. The other difference is that tibial component is from the ventral divisions of the anterior primary rami. This is from dorsal divisions of the anterior primary rami. Sciatic nerve is a branch of sacral plexus. Branch of sacral plexus. Common peroneal is from the dorsal divisions. Dorsal divisions always supply extensors, and therefore common peroneal, its branch, comes out here as deep peroneal and supplies these extensors. These extensors of the leg, which are called as dorsiflexors of the ankle. Dorsiflexion is extension. So extensor compartment of the ankle is here. That is supplied by common peroneal, deep peroneal, branch of common peroneal. Now when we discuss it as a single nerve, okay? It comes from L4 to S3. The sciatic nerve is formed, and inside this nerve, when formed, when it is inside the when it passes in the sacrum, in front of the sacrum, rather, it passes in front of the sacrum, and that time it is anterior to the piriformis muscle. The piriformis, right? The piriformis is coming out like this. So if you look from this aspect, it is anterior to the piriformis. So this aspect, it is anterior to the piriformis. And when you look from the greater sciatic notch aspect, because there will be the greater sciatic notch. This piriformis, so now this is the anterior view. Now let's look at a posterior view. पीछे से देख रहे. So when you look at a posterior view, this is greater sciatic notch. Now this I am separating these two diagrams completely, and piriformis is coming out of it. Okay, piriformis is coming out of it. Anterior to piriformis is greater sciatic nerve, sciatic nerve, which will be coming like this. बराबर है ना? उसका एंटीरियर है, एंटीरियर. तो जब हम पीछे से देखते हैं तो लगता है कि उसके नीचे से डीप से आ रही है. बिकॉज आई एम लुकिंग फ्रॉम पोस्टीरियर एस्पेक्ट, sciatic nerve is anterior to the piriformis. Okay, piriformis is posterior to it when you look from anterior aspect. Sciatic nerve is anterior. Now when you look from posterior, sciatic nerve is deep. When you are looking from posterior, whatever is deep is anterior, what is superficial is posterior. Okay, so उसका कोर्स sciatic nerve का ऐसा है कि sciatic nerve is passing from the pelvis, leaving the pelvis through greater sciatic notch, entering the gluteal region. In the gluteal region, it is lying on the obturator internus and the gamellae. And quadratus femoris. So this is quadratus femoris. This is superior gemellus. This is inferior gemellus. And this is obturator internus, tricipital tendon. These three are its deep or anterior relations. Its posterior relation will be gluteus maximus, covering all of that. Posterior or superficial relation will be gluteus maximus. Quadratus femoris starts from the ischial tuberosity and runs up to the greater trochanter. All these muscles, they get inserted on the greater trochanter only, on the quadrate tubercle. So then it leaves the gluteal region by passing between ischial tuberosity. See here, ischial tuberosity and greater trochanter. By passing between ischial tuberosity and greater trochanter and reaches the back of thigh. So course starts in pelvis where it is anterior to piriformis, leaves pelvis by passing through the greater sciatic notch, then enters gluteal region, leaves the gluteal region by passing between ischial tuberosity and greater trochanter and reaches the back of the leg. On the back of the leg, its deep relation is adductor magnus. adductor magnus. It lies on the adductor magnus. The nerve lies on the adductor magnus. So anterior relation or deep relation is adductor magnus. Posterior relation is biceps femoris, which is crossing it. Biceps femoris, which is crossing it. Lateral relation is biceps femoris. Lateral relation is biceps femoris. Medial relation. Medial relation is semitendinosus and semimembranosus. Medial relation is semimembranosus and semitendinosus. Lateral relation is biceps femoris. Posterior relation is biceps femoris. Anterior relation is adductor magnus. At the superior angle of popliteal fossa, it divides into tibial and common peroneal. Tibial and common peroneal. Now tibial nerve will supply gastrocnemius, it will supply soleus, it will supply flexor hallucis longus, flexor digitorum longus, all that. When it comes to the nerve supply, Ramit, of the sorry, I will not ask you, because I had promised that in the revision lectures I am not going to ask any questions. The students don't come, they ask questions. So when it comes to the nerve supply of semimembranosus, semitendinosus, we don't say tibial nerve, we say tibial part of sciatic nerve. Because till that point the sciatic nerve is not yet divided. So semimembranosus, semitendinosus, biceps femoris, tibial part of sciatic nerve, long head of biceps femoris. Short head of biceps femoris, common peroneal part of sciatic nerve. But gastrocnemius, tibial nerve. Okay. Applied anatomy of sciatica. Sciatica हमको ऐसा लगता है shooting pain from gluteal region to the back, from the back side right up to the ankle, foot ऐसा. I have seen sciatica patients with pain just behind the knee joint. इधर दुख रहा है. पूरा knee भी MRI सब किया. बाद में समझा कि pain यहाँ से. I myself, I had a short attack of sciatica when I was at KEM, and मुझे क्या हो रहा था मालूम है, हिप जॉइंट में पेन हो रहा था, हिप जॉइंट. मुझे लगा गया अभी हिप जॉइंट गया, एंड आई थॉट हिप रिप्लेसमेंट ये वो. ऑलरेडी मैं गूगल सर्च करने लगा कितना कॉस्ट है, क्या है, उसके बाद बैठ सकते हैं, उठ सकते हैं. फिर डर डर के ऑर्थोपेडिक ओपीडी में गया. सो खूप महत्त्वाची गोष्ट मी सांगतो. 11/08/20. So when I had that pain in the hip, I thought it is something to do with hip joint. Now I have to go for replacement, and it just turned out to be some pain because of nerve compression, which was resolved by physiotherapy. So basically we doctors, we have a tendency, because now we learn anatomy, diseases, surgery, medicines. So हमको हर एक छोटा चीज भी, everything looks like a big disease. Means for a medico, headache is brain tumor. तो डायरेक्टली सोचने लगता है क्यों 3 दिन से सर क्यों दर्द कर रहा है, why headache? Is it a brain tumor? अरे नहीं, it can be just a migraine because of excessive heat. Okay? Anything, a small lymph node, sometimes they see here, and they think lymphoma, Hodgkin's, non-Hodgkin's lymphoma. It turns out to be a lymph node enlarged due to dandruff in your hair. Okay? First time we went to the surgery ward and we saw all those inguinal hernias and all. We used to go from JJ hospital to St. George's for our posting. इतना हर्निया देखा, इतना हर्निया देखा कि हमको लगने लगा कि हमको भी है करके। तो कफ टेस्ट होता है, तो हम भी ऐसा रोज इधर सुपरफिशियल रिंग पे हाथ रख के फिर हमको हम लिटरली रोज टेस्टिंग करते थे कि हर्निया है कि नहीं। मतलब सी वी हैव टू राइज अबाउट दैट फियर, बिकॉज इट इज वेरी नेचुरल फॉर अस टू थिंक ऑफ एक्सट्रीम थिंग्स। पेट में ऐसा दर्द कर रहा है तो इंटेस्टाइनल परफोरेशन तो नहीं है, नो, ऑलवेज थिंक पॉजिटिव। मोस्ट ऑफ द टाइम्स ना ये कुछ निकलता नहीं। स्मॉल कफ लुक्स लाइक अ टीबी फॉर अस, बिकॉज वी हैव लर्न कि 15 दिन से अगर ठीक नहीं हो रहा है तो वो टीबी हो सकता है, वो टीबी हो सकता है, तो आप जाके आपका सांस हम ऐसा एडवर्टाइज टीबी तो नहीं। Sometimes it lasts more, just the inflammation of the bronchus. So medical students need to rise above fear and live a little fearless life, because now we are going to study all the diseases. You cannot be scared of everything. Okay, every fever, you cannot think here जरा सा मेरे को 4 दिन से फीवर है तो टीबी हो सकता है। नो, थैंक यू। वो ऐसा होता है, आप लोग एक्सपीरियंस करोगे, अभी नहीं फर्स्ट ईयर में, सेकेंड ईयर से आप वार्ड में जाने लगोगे ना तो वेरी कॉमन है थिंकिंग ऑफ एक्सट्रीम। सो हिप, फिर मुझे वो KM के अभी के सुप्रिटेंडेंट है डॉक्टर मोहन देसाई करके, इज ऑर्थोपेडिक, उन्होंने मुझे बोला जाओ ऑक्यूपेशनल थेरेपी में जाओ। तो एवरी डे आफ्टरनून मेरा लेक्चर होने का लंच आवर में मैं उधर जाता था। लंच आवर भी खाली हो जाता था उनका, 12:30 से 1:30 कुछ तो लंच था। तो मैं वो बॉल पे वो मेरे को बिठा के कुछ करा के उन्होंने सिखा दिया, तो मैं उधर ही सो जाता था करते करते। तो अब पोस्ट आफ्टरनून OPD के लोग आते थे, कौन है इधर, हमारा टर्न है, हाँ सॉरी। सो इट वर्क्स साइटिका। एंड व्हाट अबाउट अप्लाइड एनाटॉमी ऑफ, ये दोनों का एक कॉमन अप्लाइड एनाटॉमी है। Pain of the knee is referred to hip, pain of the hip is referred to knee, because both of them are supplying hip joint as well as the knee joint. Okay? Rachna separate. Pause. The next few LAQs which commonly are asked in lower limb are femoral triangle, popliteal fossa, arches of foot. Very easy femoral triangle. I am not going to spend the same time I had spent when I taught you for the first time. Anterior superior iliac spine, pubic tubercle, inguinal ligament, medial border of foot, lateral border of foot, sartorius, and adductor longus. So the boundaries are the medial border of adductor longus, the medial border of sartorius, and the inguinal ligament. And adductor longus not only forms the medial border, it also forms the floor. So this is a very unique situation. Then there is pectineus. Then another part of the floor is formed by psoas major and iliacus. Adductor longus, pectineus, psoas major and iliacus. Okay? तो काय पुस्तकाच्या मागच्या बाजूला 2 शिव्या लिहून शिवून असं, हां मला बोर्ड पुसायला लावला. काय केलं असतं सभागारात काय तुम्ही म्हणतो नाही, मजा करते क्या तुम लोग ऐसा कुछ ऐसा? जर्नल राइटिंग कोई करता है क्या?
करती थी, बट मेरे लाइफ में इतना दुख हो गया
बस Then the roof is formed by skin, superficial fascia, deep fascia. Superficial fascia containing great saphenous vein, containing the 3 tributaries of great saphenous vein, containing the 3 arteries arising from the femoral artery, 3 branches arising from the femoral artery. And here there is femoral sheath. I'll just draw. The femoral sheath is like this. Okay? This femoral sheath has 3 canals. Okay? The medial canal is for femoral hernia. It is for the lymph node. It is for the surgeons. In females there is femoral hernia happening. But it is Actually, you know, the reason the femoral canal is there because of increased venous return. Whenever you are running, there is increased venous return, increased arterial supply, so that they get a space to expand. This part is kept empty. But आपके कर्म अगर बेकार है तो उसमें हर्निया होता है. ओके, तो कर्म अच्छे रखना है. Then outside the femoral sheath here is the femoral nerve. So femoral nerve is not part of the femoral sheath. Femoral nerve and branches is one of the contents. Now here covering all of this, the great saphenous will come like this. यहाँ से ऐसे and then it will dip inside. When it dips inside, उसके 3 branches and उसी के साथ femoral artery के 3 branches. 3 branches के नाम याद है आपको? क्या है?
Superficial epigastric,
Superficial epigastric, superficial external pudendal, superficial circumflex iliac. Femoral artery gives 7 branches. 6 branches are given here. 7th branch is given in obturator canal, and that is descending genicular artery. Descending genicular artery, the 7th branch. 6 branches are given here. 3 superficial. Superficial external pudendal, superficial circumflex iliac, superficial epigastric. 3 deep are muscular branches, profunda femoris and deep external pudendal. Deep external pudendal. क्या बोल रहे हो? So that are branches of the profunda femoris, medial and lateral circumflex femoral artery. Okay, so is this clear? 6 branches of femoral artery. Greater saphenous vein and then cutaneous branches of the femoral nerve, medial cutaneous, intermediate cutaneous and lateral cutaneous nerve of thigh. Just remember this lateral cutaneous nerve of thigh. ये आपके पीजी नीट का क्वेश्चन है. It is not a branch of femoral nerve. It is branch directly of the lumbar plexus and it causes a condition. Meralgia paresthetica. Whether it's tingling around the lateral side of the meralgia paresthetica. वो क्वेश्चन है ही वो आता है, एनाटॉमी का क्वेश्चन में आता है वो. सो प्लीज नोट लैटरल ब्रांच, lateral cutaneous branch of the thigh from the lumbar plexus. Then somewhere here down, lower down is at the apex here of the femoral triangle is the obturator canal, Hunter's canal. Okay, that Hunter's canal anteriorly is bound by vastus medialis, posteriorly by adductor longus, medially by sartorius. Medially by vastus medialis anteriorly, adductor longus and adductor magnus posteriorly, and sartorius medially. इसमें आप कैसे ड्रॉ करेंगे मैं बताता हूँ. ये जो है ना आर्टरी, वेन एंड नर्व, artery, vein and nerve. As they come down, they become like this. Okay? Artery, vein के ऊपर चला जाता है. And then saphenous branch is coming like this. So you have to just draw in this sequence. Saphenous nerve, there will be no femoral nerve. Saphenous nerve, femoral artery. Okay? एंड उसके नीचे इज द वेन. एक के ऊपर एक सीक्वेंस में. उसके बाद देन femoral artery becomes femoral vein, popliteal vein becomes femoral vein, femoral artery becomes popliteal artery. Sorry, popliteal artery. Then यहाँ पे 2 divisions of obturator nerve रहते हैं, 2 divisions of obturator nerve and descending genicular artery. These are the contents of this Hunter's canal. Applied anatomy of the Hunter's canal. It is popliteal aneurysm के time ligation of the femoral artery can be done in this area. Okay. Coming to the last LAQ of the lower leg, and that is axis of foot. वो LAQ में आएगा, वो SAQ में आएगा, कहीं ना कहीं तो वो आ जाए. फैजल के बाजू में जो बैठे, तुम्हारा नाम क्या है? जरा पूछूं दे. Foot, any arch this is arch. Arch has an anterior pillar, it has a posterior pillar, it has an anterior end, it has a posterior end, it has a summit. There are 4 components of arch. Anterior end, ends, pillars, anterior pillar, posterior pillar, summit, and main joint, which is the main joint. Okay. Anterior end for the medial arch is formed by the head of metatarsals 1, 2 and 3. While for the lateral arch, so for the medial arch it is formed by the head of 1, 2, 3. For the lateral arch it is formed by the head of the metatarsal 4 and 5. 4 and 5. So यहाँ पे M लिख रहा हूँ, that is medial longitudinal arch. यहाँ पे L लिख रहा हूँ, that is lateral longitudinal arch. Posterior end for the medial longitudinal arch is formed by the medial tubercle of calcaneum, and for the lateral arch it is formed by the lateral tubercle of calcaneum. So posterior end बहुत easy है, anterior end बहुत easy. Anterior end is head of metatarsal 1, 2, 3, 4, 5. Medial tubercle of calcaneum, lateral tubercle of calcaneum. Posterior pillar भी बहुत easy है. For medial arch it is formed by medial half of calcaneum. Medial half of calcaneum. For the lateral arch it is formed by lateral half of calcaneum. कैल्केनियम ही दोनों का पिलर्स फॉर्म करता है, पोस्टीरियर मीडियल हाफ एंड लैटरल हाफ. नाउ एंटीरियर पिलर. एंटीरियर पिलर जो है फॉर मीडियल आर्च एंड फॉर द लैटरल आर्च इट इज डिफरेंट. सबसे अपन इजी पे जाते हैं. लैटरल आर्च इज इजी. इट इज फॉर्म बाय क्यूबॉइड and 4th and 5th metatarsal. Cuboid, 4th and 5th metatarsal. Anterior pillar. While medial arch it will be 1, 2 and 3 metatarsal. At least इतना तो आप याद रखोगे. This is 1, 2, 3 metatarsal. This is 4 and 5 metatarsal. Lateral arch. Medial arch is 1, 2, 3 metatarsal and cuneiforms. The 3 cuneiforms and navicular and talus. Navicular. Okay. So 1, 2, 3 metatarsal, 3 cuneiforms, navicular and talus. And coming to the last part, factors maintaining the arches. Factors maintaining the arches. ये अगर arch है, the factor maintaining the arch is one connecting the both ends, and that is tie beam. Tie beam. Tie beam. Connecting the ends of the arches. This tie beam for the medial and lateral arch is formed by plantar aponeurosis. जो रन करेगा ना इसे anterior to posterior. Plantar aponeurosis. And the muscles of the first layer of foot. Muscles of the first layer of foot. Tie beam. Tie beam for the transverse arch is formed by adductor longus muscle, which runs horizontally. Adductor hallucis. Adductor hallucis muscle. Adductor hallucis. Tie beam. Then intersegmental ties. यहाँ पे मैंने आपको summit नहीं बताया. Summit for the medial arch is formed by the upper surface of the talus. For the lateral arch it is formed by upper surface of calcaneus. And main joint for the medial arch is talocalcaneo-navicular joint. For the lateral arch is calcaneo-cuboid joint. Calcaneo-cuboid joint. Main joint for the medial longitudinal arch is talocalcaneo-navicular joint. Medial side पे कौन सा joint है? Talocalcaneo-navicular. Okay?